Information on prevention, tools for a healthy lifestyle. Make little changes to be the best you. It's all here. A podcast empowering, informing, and motivating Bermuda to live well. Bermuda Health-Abets. Everything from A to Z on healthy living. Brought to you by the Health Promotion and Wellness Office of the Department of Health in collaboration with local health partners.
Welcome to an episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living with the mission of empowering, informing, and motivating Bermuda residents to live well. I'm your host today, Yosifia Spence, the public health educator at the Health Promotion and Wellness Office at the Department of Health. My job entails public health initiatives like community engagement, your local health fairs that you see me at. That's what my job entails, and promoting healthy lifestyles so that we could address chronic disease. Our topic today is reducing HIV and AIDS stigma and supporting the global effort to reach zero transmission. I want to welcome our listeners, our Bermuda Health-Abetters, for tuning in to another episode of Bermuda Health-Abets. And I want to welcome our wonderful guest this morning, Anne-Marie Moore, the Sexual and Reproductive Health Program Coordinator for the Department of Health, and Sarah McAdam. Please correct me if I didn't say your name right, Sarah, from the CEO at Thames Valley Positive Supports Charity. And so I would like my guests to introduce themselves and give our audience just a little bit more about your background, who you are, and what you do. Go ahead, Sarah.
Okay, well, thank you for the warm introduction. I'm Sarah McAdam. I'm the CEO of Thames Valley Positive Support. We're a UK-based charity providing support to over 800 HIV positive people across our patch. Worked in the sector for 20 years, and I am very passionate about reducing the inequalities people living with HIV face because of their HIV status.
Thank you so much, Sarah. Anne-Marie, please give us
Hi,
a
good
little
morning,
more
everybody. Yes, of course. Hi, good morning. Lovely to be on Health-Abets, Yosefia. Thank you for the invite. So, as you said, I'm the coordinator for the Sexual and Reproductive Health Clinic at the Department of Health. My background is nursing, midwifery, health visiting over a number of years. And it's my pleasure to be working in the clinic, to be educating our community and providing a great service.
Thank you so much, Anne-Marie, and thank you so much, Sarah. So I want to just delve right into our topic today. So we're looking at reducing HIV and AIDS stigma and supporting the global efforts to reach zero transmission. So what is HIV and AIDS? Is there a difference? Are they the same?
So HIV and AIDS are like two different things, really. So HIV is the virus that can lead to AIDS, which is a collection of infections, and it's kind of the end point of HIV.
Okay. So there is a difference in the sense that it's not the same exact thing, but the HIV is the virus that leads to AIDS.
To AIDS without effective treatment, but I will speak on that a little bit more later on.
Okay, thank you so much. So when we talk about, because our topic today is stigma, right? That's the main thing. When we talk about stigma, what is stigma?
So it basically consists of negative attitudes and belief about people with HIV. It's kind of a prejudice that comes with labeling an individual as part of a group that's believed to be socially unacceptable, believing that only certain groups of people can get HIV, making moral judgments about people who take steps to prevent HIV transmission, or feeling that people even deserve to get HIV simply because of their choices. So, historically, stigma was channeled into overt discrimination towards sort of gay and bisexual men and people with HIV and AIDS. Um, so it's kind of it's a discrimination, and it's obviously a lack of understanding about HIV, and that has persisted for 40 years. We had the first reported case about 40 years ago.
Right.
So, Yosefia, this poses a challenge really for society as a whole.
Mm-hmm.
Um, because people living with HIV shouldn't feel ashamed and they
Mm-hmm.
shouldn't feel stigmatized. And we really should not be facing new infections, which really might have been avoided in the absence of HIV stigma and the
Mm-hmm.
shame that goes along with it.
Thank you so much. I really appreciate that, because I think we struggle with that with a lot of things within our society. And we put everything on choice or lifestyles, rather than really understanding things, and trying to help our fellow community. So I appreciate that explanation. So what are some main misconceptions about HIV that contribute to that stigma?
Sure. Well, I have several points that I'd like to make here. Um, but the main thing that I want to get across is that, this stigma can stop people from getting tested, from
Mm,
accessing treatment, and basically even from living well with HIV.
mm-hmm,
And, the myths that are surrounding HIV and the treatment and the reality of living with HIV today can consist of things like HIV and AIDS are the same thing.
mm-hmm,
So this is what you asked earlier. So let me explain that HIV is the name of the virus, and AIDS, what we now call late stage or advanced HIV, is the name of a collection of illnesses caused by this virus. So
mm-hmm.
you can't get an AIDS diagnosis unless you're already HIV positive. But
Okay.
many people who have HIV will never have AIDS. And this is because of the advances in HIV treatment. That means that HIV is now a long term manageable condition.
Okay.
So that's the first myth. The second myth that I'd like to explore is HIV is a death sentence. Well, of course it isn't. However, before advances in treatment,
Mm-hmm.
someone diagnosed with HIV in the 80s and 90s,
Right.
when we had that epidemic, um, really did have a very short time to live, because there was no treatment. People today living with HIV can live long, healthy lives if they are on treatment. So they can expect to live as long as anyone else.
Mm-hmm.
We're actually now seeing the first generation of HIV positive people growing old, living with HIV.
That's
So
amazing. I love
it
that.
is amazing, but it does also bring the challenges, Yosefia. So because we need to support these people to live
Mm-hmm.
well as they get older. They are entitled to that as much as anyone else.
Right. I agree. Just as much
Yeah,
as, say, for instance, growing older and managing diabetes, right? I think that
absolutely.
we should all have that opportunity. I thank you for that explanation, because I recognize that even my own biases or beliefs, with a lack of understanding, you know,
Yes,
can
absolutely.
can affect how I think or see things. And I know from when I was growing up, and I was born in the late 80s, so I wasn't there to really understand the movement and the things that were going on, and the things that people were fighting for in terms of having treatment and having access, and not being discriminated against as a result of sexual orientation, because of the
Mhm.
correlation that was being made between HIV and AIDS. So I really appreciate that. So
Absolutely.
how because you know what you talked about earlier how it impacts people's help seeking and people's feeling of shame around HIV and AIDS. So how does stigma impact on mental health and well-being of people living with AIDS? Because I can imagine that that would lead to some level of consequence.
Yeah, it really can negatively affect the health and well-being of people living with HIV in quite a number of ways, really. They tend to have higher rates of mental health problems,
Mm-hmm.
um, and because stigma makes them feel bad about themselves, because of their diagnosis.
Mm-hmm.
The stigma can kind of discourage some individuals from learning their HIV status, for example, getting tested,
Mm-hmm.
from accessing treatment and staying in care, from seeking HIV prevention tools and testing, such as education and pre exposure treatment. Um, it prevents people from talking openly with their sex partners about, safer sex
Mm-hmm.
options. Um,
Yes.
and it fulminates in worrying about being treated differently, and they can have low self-esteem, and yes, the shame comes in it, and it discourages people from sharing their HIV status with anyone else besides maybe healthcare staff. So, there's things like anxiety, depression. People living with HIV can feel isolated because they start to internalize that stigma associated with being HIV positive. So even family can exclude somebody with living with HIV from activities. Even friendship groups can exclude people living with
Mm-hmm.
HIV. So they feel low, they're worried, they feel hopeless, and it really does affect their everyday life.
Mm-hmm.
Um, so it just makes things more complicated and stressful because of the
Mm-hmm.
stigma attached to HIV. They can feel marginalized and ignored by mainstream society. And they can definitely have difficulty accessing the same opportunities and services as other
Mm-hmm.
people. It's discrimination. It's unfair, and it can make people feel traumatized.
Mm.
They can even be open to harassment and verbal abuse or even physical abuse. And this brings about fear, uncertainty, guilt, embarrassment, even anger and a sadness because you are HIV positive.
Wow. Um, that's horrifying in the sense of what persons have to experience. I really am hoping that our community can understand the impact that we can have on others with our negative thoughts and attitudes, and not seeking out information so that we are more knowledgeable and aware, and that we are not inflicting stigma upon other people. So mental health is a major component of overall health, right? And I think that it also
Absolutely.
is connected to how we experience physical health. My
Yes,
thought
it
when you gave the explanation was about how are they, affected even when it comes to healthcare systems, because you indicated even access to services. So I do imagine even healthcare professionals should be a bit more knowledgeable around these topics, so that we as
does.
well avoid discrimination within our systems. Because can you imagine trying to
Yes,
get treatment,
yes,
and you're experiencing the very same stigma that you're experiencing from people who are not knowledgeable, and then people who should be a part of a system that should be more aware and
absolutely.
seeking help. So wow. Wow,
I
that's
think
yeah.
it's this internal feeling of shame,
Mm-hmm.
not necessarily uh, sort of reflective of healthcare
Mm-hmm.
workers. We're all, most of us have advanced with the knowledge that has come with HIV
Mm-hmm.
treatment, etc. But it's the person internalizing their shame and their anger and their
Mm-hmm.
embarrassment and actively stopping themselves from accessing healthcare services.
Hmm. Thank you for that clarification. So, how does HIV stigma impact on the global effort to reach zero transmission by 2030?
Well, this goal is part of the United Nations Sustainable Development Goal, and
Mm-hmm.
it aims to end AIDS as a public health threat. So the goal is to reduce the number of new HIV infections and AIDS-related deaths by 90% between 2010 and 2030. If we're going to reach this goal, then we need everyone to know their HIV status. Those that already know their status are helping achieve this goal, so they should be celebrated. Well done them. But we need to encourage those that don't know their status to get tested, because they could unknowingly be passing HIV on to other people. It sounds really simple, but in reality, stigma is one of the barriers to people testing. So the goal is achievable, but whilst
Mm-hmm.
there's so much stigma associated with HIV, it's actually going to be quite challenging to reach that point.
Thank you. I understand that. Wow. Thank you so much to those who do know their status and are contributing to that goal. How can society create a safe and supportive environment for those living with HIV to diminish the stigma and create the space where we can work towards that goal?
Well, there are many small things that you can do to make a big difference. You know, if we all commit to making positive changes in our families and communities, we can help end HIV stigma and work together to stop HIV together, as Sarah was saying. So, let me give you a couple of scenarios, if I may. So, stopping HIV discrimination and stigma in families, for example.
Mm-hmm.
So you arrive at a family reunion picnic with your sister, who recently shared with the family that she was diagnosed with HIV.
Mm-hmm.
As you make your way around to say hello and offer hugs to the family members, your cousin hesitates when greeting your sister, commenting, "I'm not going to get it, am I?" So,
Mm.
what can you do as an individual observing that particular scenario? So, you know, you can model good behavior, positive behavior by hugging your sister.
Mm-hmm.
Um, you can encourage your cousin to go and seek HIV basic facts about how it's transmitted. You can say something like, you know, "I'm not sure if you know, but HIV is not spread by hugging, shaking hands, or socially kissing someone who has HIV, because the HIV virus cannot survive outside the body."
Mm-hmm.
So, you know, you can offer to have a conversation and answer any other questions that your cousin might have about HIV, and certainly follow up later with an email or text that links to, you know, educational resources, so the person can become more knowledgeable, and that will dispel the fears and the reaction in that situation.
Hmm.
So, if I can give you another scenario, if I may.
Mm-hmm.
Um, so, if we're amongst friends, for example, so, you know, your friend gathers you and several others to disclose that he or she has HIV. And one of your friend's reaction is, "How did you get it? And do you know who gave it to you?"
Mm.
So, sort of make that person feel supportive and not ashamed, stigmatized, glared at in that instance. So you can redirect the conversation by showing some empathy and saying something like, you know, "We're just happy you felt comfortable sharing this with us.
Mm-hmm.
Do you want to talk more about how you're feeling?" Um, Ask your friend if they've sought treatment. And if not, offer to go with your friend to visit the doctor or the clinic, and so that they can explore their options for treatment. And later, you can talk to your friend who posed the question and explain that asking about transmission is insensitive. This would be a good time to explain what HIV stigma is and how it can be a barrier to treatment for those with HIV. Try not to pass judgment. Instead, show some sympathy and, help them learn more. Because learning more about HIV is one of the first steps to support, friends and loved ones living with a healthy life, to live a healthy life with HIV. So education is the key. You can learn about transmission, treatment options, etc. Communicating openly and asking questions about HIV is important to promote learning and understanding. But remember, we all have to do our part in being thoughtful and supportive rather than stigmatizing or being offensive in our responses to situation of HIV disclosure or misunderstanding about HIV.
Thank you so much for that. I do feel that individuals have a personal responsibility to challenge their own beliefs around things so that we are not perpetuating the stigma. And even when you are in situations where you can challenge others' beliefs and the stigmatizing responses to things, I do appreciate the scenarios you provided, because those are very real things and very real responses that persons may have in situations. And it really is just not being aware and sometimes even unintentional, right?
Absolutely.
So
Absolutely.
yes, I mean, but
And
sometimes you're like, why would you say that? But sometimes we really are just unaware, and it really is helpful to gain more knowledge around things, and maybe not ask certain questions. If you want to know more, maybe ask more about, I don't know.
yes, and
It's
even we even have to be mindful, Safia, of language. For example, talking about people living with HIV as victims, sufferers, contaminated or sick, it's not ideal language, and it does not promote a supportive environment. You need to refer to them as people living, or a person living with HIV.
right.
Such terms like that imply, if you're calling somebody a victim or a sufferer, it can make them feel powerless, with no control over their lives. And it's so unhelpful because it's so negative, and it defines that person and their condition in an entirely different way, and it can cause segregation.
I completely agree with that. Yes, I think we have to consider when we do say things and how we interact with our fellow humans. What personal biases or stereotypes might people hold about HIV, and how can they challenge them? And I know we've talked a little bit about this already, but if you have anything to add to that, please do.
Okay, I think there are so many kind of over the 40 years of HIV. So lots and lots of people assume it will never affect them. It's a gay disease. It's only found in Africa. Or when we go out and do community HIV testing, a lot of people say, well, I don't need to test because I only sleep with people who are clean. What does that even mean? Or I'm
Oh,
very
wow.
choosy. Yeah, I'm very choosy about who I sleep with. And then there's the narrative that people with HIV must have done something bad to get it. They're dirty, unclean, they're contagious, which Anne-Marie has already alluded to. So the stigma is strong. And because of the stigma, I can understand why people might have those views, but they're completely wrong. So we need to view HIV in the same way as we view other long-term conditions, diabetes, arthritis. No one's worried about contracting diabetes by being in the same room as a diabetic. And it's the same for HIV. So we need to learn more as a society. And there are lots of angles to approach this, because I think if you say to someone, oh, you need to learn more about HIV, they just, oh God, where do I start? Choose an angle that interests you. If you like science, look at the science and the progression around medication. If you love history, look at the history of HIV, because it dates back to the 1920s. If you're interested in the world around us, look at the societal impact and listen to the HIV podcast, which is the podcast that I co-host, because I guarantee people won't believe how many aspects of our lives are touched by HIV, whether it's famous people or events in history. HIV is interwoven into so many things. Ultimately, we've got to do whatever it takes to normalize HIV. That's what we need to do.
It doesn't, there's no specific person that, you know, HIV is choosing to, right? We can all be affected by this, right? And the key is awareness. So what is the name of your podcast? Because listeners, we have Sarah here from one of our international partners, again, which is Thames Valley Positive Supports Charity based in the UK, correct?
That is
And so
correct.
what's the name of your podcast?
Our podcast is called the HIV Podcast, and it
Okay.
looks at all aspects of HIV, famous people who were diagnosed, events that have happened in history, as well as different educational topics. So it's a good way to start learning more and to start normalizing HIV.
Thank you. So if you're interested, check out the podcast, and as well as continue to listen to Bermuda Health-Abets, because we do have an array of topics that we'd like to talk about that to support health. So how can people help spread the you versus you message? Because I know that is that a theme for World AIDS Day this year, or is that just an overall message for the movement to reduce stigma around
This
HIV and
is
AIDS?
This is an overall message, and it's one that's not shared widely enough. So U equals U is undetectable equals untransmittable. So if a positive person is taking medication every day, it reduces the level of virus in their bloodstream to such an extent the virus cannot be detected. Doesn't mean they no longer have HIV. It means the medication is doing its job. If an HIV positive person is undetectable, they cannot pass HIV on through unprotected sex. This prevention method is one of the biggest scientific breakthroughs of our time. I know I'm biased and some of your listeners might disagree, but I stand by what I say. And because of that, I mean, it really helps lessen the stigma. Positive people have never posed a risk. Those that don't know their status do, but positive people don't. And U equals U really helps prove this case. So if your listeners want to help us, then share that amazing bit of news. Next person you bump into, say, do you know what I found out today? Someone's living with HIV and they're undetectable. They can't pass the virus on. And then signpost them to this podcast episode, because they might not believe you. It's one of the biggest challenges about U equals U, getting people to believe that it's true.
Thank you so much for that. I am grateful for that bit of information myself. And I think that it's important for us to recognize that, you know, those new things that have come about, or some of the advances that have come as time goes on. So U equals U, again, look it up, listen to the podcast, find out a bit more about that. Just before we wrap up, I just want to know, Anne-Marie, can you give us just a little bit of information around what services are available locally in Bermuda for persons who want to get tested, and then who have been tested and potentially diagnosed? What supports and services can they access here in Bermuda?
Absolutely. So, you know, the Sexual and Reproductive Health Clinic at Department of Health on Victoria Street, we will confidentially test you for HIV. And we do advise that you at least get one HIV test a year. But if you're with a new partner, it's also a good idea to get sexual health screening, including HIV testing. It's a simple blood test. So you're most welcome to call up, make an appointment, and we will do an HIV test for you confidentially, and any other screening that you would like. We provide education, any type of health promotion stuff. We give good advice, so please do contact us. The other thing that you can do is, if you are living with HIV, there is support out there. The Lighthouse, a Star charity, is a residential accommodation that basically supports people living with HIV, especially if you are needing financial assistance, if you're needing somewhere to stay. And Dr. Carolyn Armstrong is the CEO of that charity. So I would advise that you do contact Lighthouse.
Thank you so much, Anne-Marie. I want to encourage everyone to use the services that we do have available here, and seek out those supports, and don't struggle in silence. Don't struggle alone in terms of, the needs that you have to live a healthy, long life. So, and I want to thank our guest, Sarah McAdam, I hope I said that correctly, and Anne-Marie Moore for coming on and having this robust discussion with us. It's I think this is a very important discussion, because anywhere that we can reduce stigma to help our fellow community, I think it's a benefit to our community overall, not just individuals who are affected by the stigma. And I want to thank them for sharing their knowledge and expertise on this topic. I want to thank our listeners, our Bermuda Health-Abetters, for tuning in to another episode of Bermuda Health-Abets, a podcast where we discuss everything from A to Z on healthy living. To find more episodes of Bermuda Health-Abets, you can go to Department of Health's Facebook page or our YouTube channel at Department of Health Bermuda. So thank you so much, listeners, and thank you so much to our guests, and tune in for more episodes.
You have been listening to Bermuda Health-Abets. Please note, anything you heard on this podcast is not a substitute for visiting your healthcare provider. If you have a topic or want a question answered, please contact the Health Promotion and Wellness Office of the Department of Health by emailing healthpromotion@gov.bm or by calling 278-4900. Be sure to listen out for the next episode of Bermuda Health-Abets.